I'm Neil Helenius, and I'm a patient partner at Essentia Health. My pediatrician told me about this council and asked if he could put me in contact with them because my daughters were born premature. I wanted to get involved because I wanted to make a difference in making the healthcare system fit my family and other kids.
This Essentia crew looks at healthcare from Essentia from the patient's perspective.
They are taking patients from every walk of life, and they are asking our opinions and our suggestions, and they are listening to what we have to say, and then they make changes.
Patient Partners is our commitment in listening to patients and their families about how we can better take care of them when they're here.
It's just changing the way medicine has been done since, the beginning of time.
Too long in medicine we've been very paternalistic in how we deal with patients, not taking the time to ask them what they want or what's important to them.
Whereas in a system that offers patient and family-centered care, there is a commitment to partnership. So rather than doing things 2 and 4, we're partnering with patients and families in order to ensure that they have the best patient experience possible. There are 19 different patient and family advisory councils.
We meet every month discussing the ways that Essentia Health can be more reactive. What does the patient need? What is the patient's perspective?
And on those 19 councils, there are roughly about 280 patient and family partners. And then in addition, we have a number of mentoring programs. The most well-developed is our oncology program. There are about 70 trained mentors in that program.
When the mentor program was established at Essentia, I said, I'm certainly available. Enter Mary Beth, who was diagnosed with the same type of rare cancer.
I probably wouldn't be here. Yeah, if it wasn't for Levon. It was so bad, I honestly just didn't think that I could go on. I know she's there. If I'm having a really bad day or bad week or bad month or bad 6 months, she helps me to see the bigger picture.
Levon was she directed the training, she helped us write it, she built that program.
It's a journey for patients, and being able to have input into how Essentia Health can improve that, I think is important.
Our patient partners, when they sign up, they stay with us because they actually see the changes that are being impacted because of what they tell us. We're making changes, we're changing healthcare, and we're doing it with our patient and family partners.
My son Evan had his tonsils out. We had the opportunity to go back with Evan while he was getting the anesthesia.
This actually was something that came out of our very first advisory council that was ever formed.
10 years ago, it was just protocol where patient was just taken back, say goodbye to mom and dad, and have at it, we'll take care of your child. And then the parents are left feeling anxious and worried and nervous. And this is much better.
We don't just want to administer anesthesia, but we want to create as stress-free and meaningful an experience as possible.
One of the things that we're really working on in terms of the patient and family-centered care experience is that families are not visitors. We really want to change that concept.
It used to be that when patients were critically ill, they were placed in an intensive care unit. They were separated from their families who needed to wait in waiting rooms until they were cleared to come in for short visits. And that's uncomfortable.
When Melissa was brought to the ICU, they signed me out one of these badges, which is just a security pass key that unlocks the door. And I think whoever came up with this idea is a genius. Now, had I not been given this card where you had to call in every time you go and see someone, that's just time. What if it was something like an emergency where I need to be there right there and then?
It's in critical illness that patients are most scared and vulnerable. And we want the families to be at the bedside to provide the comfort and the strength so that they can get through this critical illness.
Definitely would like to thank the patient partners for their idea of instituting this card, this badge system at the neurotrauma ICU.
I'm really proud to be a part of something like this. I think it's personally rewarding, but also to know that I'm working for an organization that really does value what its, patients really have to say and really wants to work with them in partnership to design their healthcare. I think that feels good.
That means the world to me as a parent of two little girls who spent a better part of their first 2 years of their life in those hospitals. So it gives you a sense of comfort and it helps you sleep a little bit better at night knowing that there's people out there that really care.
Patient Partners has been so successful, we would want everybody to be part of this effort.
I would highly encourage people to become involved in it. Yes.
We are looking really to engage with as many patient and family partners as we can, and because we really believe that diversity of perspective really will help us do better. If you are interested in becoming a patient and family partner, visit our website and sign up.